She was the new girl, a shy nurse, hastily hired for the corporate clinic on the 12th floor, treated as disposable by the arrogant Dr. Hargrove, the chief surgeon who never bothered to learn her name. When the company's vice president collapsed with severe internal hemorrhaging, no operating room, no blood supply, no time. She did what no one else there knew how to do, with instruments that were never meant for that purpose, with hands that seemed to carry a memory of their own. Which doctor performed that impossible surgery? Dr. Hargrove asked, stunned. The new nurse, they said. He didn't believe it. No one believed it. But before anyone could ask the right question, before anyone could look her in the eyes and ask who she really was, something shifted in the air on the 12th floor. A smell. A strange color in the smoke beginning to seep through the crack beneath the door. What happened in that place after that shocked everyone, and became a moment forever etched in history. If you've ever been underestimated by someone who had no idea who they were dealing with, this story is for you. Hit that like button, drop a comment telling me where in the world you're listening from right now. And if you're not subscribed yet, welcome. You've just found your new favorite channel. Let's begin. You missed a spot. Dr. Hargrove didn't look up from his phone when he said it. Claire Weston set down the supply cart and turned. The counter behind her was spotless. Every surface in the 12th floor clinic of Meridian Tower was spotless. She had arrived at 6:15 that morning to make sure of it. Every surface in examination room 1. Done. Examination room 2. Done. Upper cabinet restocked. Medication dates checked. 3 past date items replaced. Sharps container reorganized. Inventory form updated to flag the 16-gauge catheters running low. All of that before 7 o'clock. It was now 7:58. I'm sorry, she said. The corner of the cabinet. His thumb scrolled across his phone screen. There's a smudge. Wipe it down before anyone comes in. Claire looked at the cabinet. There was no smudge. She picked up the cloth anyway and wiped it down. Dr. Marcus Hargrove, Chief Medical Officer of Meridian Global Corporation, was not a difficult man to read. He was the kind of man who had sailed through medical school on his father's name and his mother's connections. He had graduated from Johns Hopkins in 1992, third from the bottom of his class, in a year that had 37 students. He had framed his diploma before the ink was dry. 54 years old, silver-haired, the careful handsomeness of a man who spent money on grooming and called it professionalism. He had never in his career treated anything more serious than a sprained wrist or a blood pressure reading that needed a second opinion. This clinic on the 12th floor of Meridian Tower was his kingdom. 2,200 square feet of beige walls, sealed carpet, recessed lighting that buzzed faintly when the building's air handling system was under load. 2 examination rooms, a supply closet, a waiting area with 6 chairs in a shade of gray that matched nothing. It served 712 employees spread across the building's 25 floors. Most of them never came in. The ones who did came for blood pressure checks and flu shots, and the occasional anxiety attack that could be managed with a glass of water and 15 minutes on the phone with HR. Real medicine happened somewhere else. That suited Hargrove fine. And Claire Weston was, in his exact words, the temporary replacement. The previous nurse, Sandra, had submitted her resignation by email at 11:40 on a Tuesday night and not come back. The nurse before Sandra, Paula, had lasted 4 months. The nurse before Paula, whose name Hargrove had already forgotten, had lasted 6. He had handled the recruiting himself, which meant he had glanced at 2 resumes and picked the name that sounded the least complicated. Her file said she had 6 years of nursing experience. It said she had worked in field hospitals and rural clinics. It said she had a master's in emergency trauma care from a state university he had never heard of. Hargrove had not read past the first paragraph. She was a nurse. She would do. That was the entirety of his assessment of Claire Weston. She had been 20 minutes early on her first day, every day since. She never left supplies disorganized. Restocking happened before he could notice anything was running low. She was quiet in the way that people are quiet when they have spent time in places where making noise gets you killed. Hargrove had noticed none of this. He noticed the smudge that wasn't there. He noticed when she didn't smile at the right moment. He noticed when she filled out incident reports in more detail than he wanted. These are too long. He had told her on her third day, sliding a form back across the counter without looking up from his laptop. This is a corporate clinic, not a battlefield. Keep it brief. Claire had looked at the form, then at him. These are the required fields, she said. He had already walked away. That was how it went. She had been at Meridian Tower for 11 days. In those 11 days, she had learned the layout of all 25 floors from the fire exit maps in the stairwells. She had counted the steps from the clinic to the nearest emergency staircase. 17 steps and 2 corridor turns. She had noted the fire suppression panel positions on her floor. 3 exits on level 12, all assessed, all ranked by likely clearance in various scenarios. She had cataloged every piece of medical equipment in the supply closet and identified the 4 most critical things that were missing from a truly functional emergency kit. A tourniquet, a chest decompression needle, a surgical airway kit, and a proper set of vascular clamps. She had not told Hargrove any of this. She kept her hands busy and her eyes moving and her mouth shut. That was the plan. Stay invisible, do the job, go home, don't let them see you. Claire was 34 years old, 5'5", and built like someone who had learned to carry weight over long distances without making it obvious. Her hair was dark auburn, pulled back in a ponytail that was always slightly too loose for a clinical setting and slightly too tight for comfort. Her eyes were green, the kind that caught light in a way that made people look twice, but she had trained herself to keep them low. Looking too long at things got you noticed. She wore pale blue scrubs, 2 sizes too large. She moved in them like water, like the extra fabric was simply part of her. A faint shrapnel scar ran across the back of her right hand, pale and old. Another crossed the knuckle of her left thumb. A thin white line sat above her right eyebrow, the kind left by a suture placed in a forward operating base in a country whose name she still would not say out loud. She kept her hands in her pockets or behind the counter when she wasn't using them. Old habit. She ate lunch alone in the supply closet, sitting on a step stool with a protein bar and bad coffee from the machine down the hall. The rooftop terrace was not for her. Neither were the birthday gatherings in the 3rd floor conference room. She said good morning to Frank Mercer, the security guard at the lobby desk, every single day. Frank was 61 years old. He had a bad knee from a construction accident in 2004 and a daughter starting college in September, and a coffee thermos with a Marine Corps insignia that he brought from home because he didn't trust the office machine. Claire had not asked him about any of this. She had learned it because she listened when other people talked. And Frank talked to himself at low volume when he thought no one was near the elevator bank. She was always near. Another old habit. The clinic opened at 8. By 8:15, a man from accounting had come in with a headache, and she had given him water and monitored his pressure and sent him back with instructions to eat before noon. By 9, a woman from marketing had come in with a rash on her forearm that turned out to be contact dermatitis from a new hand cream. By 10, she had quietly reorganized the crash cart in examination room 2. The cart had been improperly stocked since before she arrived. The defibrillator pads were 4 months past expiration. The endotracheal tubes were the wrong size for an adult airway. The epinephrine was there, but the dosing chart above it was outdated by 3 years. She had corrected all of it methodically across her first week, without documenting the corrections in a form Hargrove might read and ask questions about. She did not want to explain how she knew to look for these things. At 10:40, Hargrove came into the clinic with his coffee and his tablet and looked at her with the mild expression of a man who had nearly forgotten she was there. "I have a board lunch at noon," he said. "Gone until 3. Don't touch anything in my office." "I wouldn't," Claire said. "If compliance calls about the wellness audit, Tell them I'm reviewing the documentation. Of course. He looked at her for a moment. The flat look of a man who had never once wondered who another person actually was. You know this position has high turnover, he said. Sandra mentioned that before she left. Most people find the work unrewarding. A small, practiced smile. It's not exactly emergency medicine. He said it like the last two words were a category she could not conceivably understand. Claire said nothing. He left. She sat behind the reception desk with the medical textbook from her bag open on her lap. Not for new information. She read it the way other people listened to music. The familiar language was a kind of quiet. She was on page 47 when the door to the corridor hit the wall. Not the slow push of someone coming in for a headache. It hit the way a door hits when the person pushing it is no longer thinking about the door. Two men in suit jackets came through first, both pale, both breathing the way people breathe when adrenaline has overridden everything else. Between them they were carrying a third man, not quite carrying, supporting, but only barely. Gerald Ashford, Executive Vice President of Meridian Global Corporation, was a large man, 6'1", 235 pounds, 60 years old. Right now he was weighing every pound of that. His face was the color of old candle wax. His right arm was pressed flat against his abdomen. His breathing was audible from across the room. Claire was on her feet before the door finished moving. She did not run. She walked. Fast and deliberate and perfectly controlled. Examination room 1, she said. Through that door. Now. The two men looked at her, then at each other. They did what she said. She pushed open the door to examination room 1, and the two men brought Ashford through with the inelegant handling of people who had never been inside a real emergency before. They set him on the table the way you set down something heavy that you are afraid to drop. He groaned. It was a low sound, not a cry, the kind of groan that comes from a pain too deep for noise. Step back, Claire said. Her voice was different from the voice she used with Hargrove. Not louder, not harder, quieter and older, the kind of tone that had been learned in places where it needed to work on the first use. Both men stepped back without understanding why. People rarely questioned that particular tone. She pulled on gloves in 2 clean, practiced movements. She took his pulse at the radial. Thready, fast. 69 beats per minute, but weak in a way that told her more than the number did. She looked at his face, pale, diaphoretic, skin cold and clammy under her fingers. She pressed 2 fingers below his right rib cage. He flinched violently and grabbed the edge of the table with his left hand. She pressed again, slightly lower, slightly more medial. The rigidity she felt beneath her fingers was not muscular tension. It was guarding. Involuntary abdominal guarding. The kind the body produces when something inside is doing something that the body knows is wrong. Something in this man was bleeding. What happened? She asked without looking up. The man with the loosened tie spoke. He fell. In the stairwell on 14. He was going up, and he said he caught the railing, but he hit the edge of the step on his way down and... How long ago? 40 minutes. Maybe 45. He said it was nothing. He said he was fine. The man's voice cracked slightly at the edges. We were in the meeting, and then he just went down when he stood up to get coffee. He reached for the coffee and his legs went out, the other man said. I understand, Claire said. She looked at Ashford. Mr. Ashford, I need you to tell me where the pain is worst right now. He turned his head toward her slowly. His eyes were working hard to stay focused. Stomach, he said. The word barely made it out. Right side. Hit the step edge. Fell on it hard. Did you feel or hear anything crack when you fell? A pause. Maybe. Can you take a deep breath for me? He tried. He stopped before his lungs were a third full. His face went a shade paler. She noted the depth he could manage. She pulled the blood pressure cuff from the wall mount and wrapped it around his right arm. 84/51. The number sat in her chest like a cold weight. She did not let it reach her face. "I need you both to wait in the reception area," she said to the two men. "Is he going to be okay?" the man with the loosened tie said. "I need you to wait in the reception area," she said again. Same tone, same current. They left. She turned back to the table. She pressed her palm flat against Ashford's abdomen and moved it slowly through the quadrants. Rigid from the epigastrium to the right lower quadrant. Not muscular, not positional, involuntary, diffuse, and getting worse. He had blood pooling somewhere she couldn't see and couldn't reach with what was in this room. She reached for the phone on the wall and called Hargrove's cell. 7 rings. Voicemail. She called the front desk. "This is Claire Weston, 12th floor clinic. I need Dr. Hargrove's location. Medical emergency." A pause. A brief fumble. "He's in the Meridian Club on 43. He left instructions not to..." "Call him to the clinic now. Tell him it's Mr. Ashford and it can't wait." She hung up. Called 911. Claire gave them the address and the floor and the mechanism of injury and her preliminary assessment in the compact sequential language of someone who had called in medical emergencies before. Not to a dispatch center, to a radio operator, in very different circumstances. ETA 18 minutes. 18 minutes was a long time. She looked at the supply cabinet and ran through what she had the way she had learned to run through what she had in places where you could not go back for something you'd missed. 2 16-gauge angiocatheters, 4 bags of normal saline, a blood pressure cuff, a pulse oximeter, 2 small portable oxygen units in the closet, syringes, needles, gauze, medical tape, the basic suture kit in the bottom drawer. She began moving before she had finished the mental list. She found the largest vein in his right antecubital fossa on the first pass, clean flash of blood in the chamber, taped and connected in under 30 seconds. She crossed to the left arm and repeated it. "Run both wide open," she said to herself. She connected both bags. She stood back and assessed. The saline was running. She attached the pulse oximeter. 92%. She looked at the monitor she had connected to his chest. Heart rate 107. Rising. Compensatory tachycardia. His body pumping faster to maintain a pressure that was already failing. It could sustain that for a while. Not for long. Hargrove came through the clinic door at 12:19. He still had a linen napkin tucked into his collar from the board lunch. He stopped in the doorway of examination room 1 and looked at what was on the table. Claire watched his face move through 4 distinct expressions in the span of 3 seconds. Surprise, confusion, the practiced construction of authority, and underneath it, very quickly, the beginning of something that looked like fear. He covered it the way he covered everything, with posture. "What happened?" he said. Moving to the side of the table, Claire gave him the full picture in 10 seconds. Fall in the stairwell, blunt abdominal trauma right side, 45 minutes elapsed, pressure 84 on arrival now dropping, rigid abdomen, guarding diffuse right quadrant, hemodynamic instability consistent with intra-abdominal hemorrhage. Hargrove picked up Ashford's wrist, took his pulse, put it down. "We need to transport him," he said. "EMS is 16 minutes out. His pressure is continuing to fall. I've got 2 large-bore IVs running wide open with normal saline. We should wait for EMS and..." "His pressure dropped 6 points in the time it took you to walk from the elevator," she said. Hargrove's jaw tightened. He did not like being interrupted. He especially did not like being interrupted by someone he considered a subordinate, in a room where the person in front of her was proving, with every vital sign, that he did not have time for her to be polite about it. He looked at the monitor. 79/48. "We keep him still," he said. "We maintain the fluid." "Yes," Claire said. "And we need to call ahead to the trauma center. Tell them incoming. Mechanism of injury. Suspected intra-abdominal hemorrhage. Hemodynamic instability. Probable need for emergency surgical intervention. I'll handle that, he said. He moved toward the phone. She moved toward the supply cabinet. Not for saline. She was looking at the cabinet the way she had looked at supply closets in buildings that had no electricity, in tents that had no equipment, in situations where the margin between the person on the ground living or not had come down entirely to what she could find within arm's reach. The suture kit was in the bottom drawer, a scalpel, curved needles, suture thread, forceps, scissors, 2 clamps, not surgical grade, not designed for what she was thinking. But there. She closed the cabinet and went back to the monitor. 73/44. Hargrove, she said. He was still on the phone. He looked at her with the expression of someone being interrupted a second time. She pointed at the monitor. He looked. He said something brief and clinical into the phone and hung up. He came to stand beside her. Both of them looked at the number. EMS is 13 minutes out, he said. She looked at Ashford. His lips were no longer pink. They were the pale lavender of tissue that was not getting enough blood. His eyes were half closed. His breathing had gone fast and shallow. He is not going to make 13 minutes at this trajectory, she said quietly. Hargrove said nothing. She walked back to the supply cabinet. Bottom drawer. The suture kit came out and went onto the tray beside the table. No hurry, no drama. Without drama. The way she did every task in this clinic. Quietly and exactly. What is that for? Hargrove said. She opened the kit and laid each instrument on the sterile field. Scalpel, forceps, clamps, scissors, suture. She arranged them in the order she would need them. Claire, Hargrove said. She picked up the 16-gauge needle from the supply tray. She felt along Ashford's lower right abdomen, found the landmark, 2 centimeters medial to the anterior superior iliac spine, diagnostic aspiration. She angled the needle 30 degrees toward the umbilicus and pressed it in slowly, steadily. 1/4 inch, 1/2 inch. The resistance changed. The barrel of the syringe filled dark red, intra-abdominal hemorrhage, confirmed. She withdrew the needle and capped it and set it aside. She turned to Hargrove. He was staring at the syringe. He is bleeding into his abdomen, she said. The source is most likely mesenteric or hepatic from the blunt impact. Without intervention in the next several minutes, his pressure will fall below the threshold for cerebral perfusion. Hargrove stared at the syringe, then at her. You cannot operate here, he said. You are a nurse. This is a corporate clinic. There is no anesthesia, no surgical team, no imaging, no blood. I know, she said. Then you cannot. Step back, she said. It was not loud. It was not angry. It simply moved through the room with the finality of someone who had given that instruction before, in situations where there was no time remaining for a second attempt. Hargrove stopped talking. He took one step back, and Claire Weston picked up the scalpel. Her hands did not shake. That was the first thing Hargrove noticed, and it would stay with him longest afterward. He had seen surgeons walk into operating rooms with tremor at the threshold of incision. He had seen residents white-knuckle a scalpel in simulation labs. He had, if he was honest, done both in his younger years. This woman's hands were absolutely still. She had replaced the outer gloves with the single sterile pair from the suture kit. The betadine swab went in the precise outward circular motion of someone who had prepped surgical fields in conditions where sterile technique was aspirational rather than guaranteed. She had positioned the overhead light so it fell exactly where she needed it. No request for help, only the man on the table. Gerald Ashford's pressure had dropped to 46/29. His breathing was fast and shallow. She leaned close to his ear. "Mr. Ashford," she said. Her voice had changed entirely. Not the brisk instruction she gave Hargrove. Not the flat courtesy she gave the patients who came for blood pressure checks. Something that had the specific quality of a voice that had sat beside people in terrible moments and knew what weight to carry there. "I need you to be very still," she said. "Can you do that?" He moved his head the smallest fraction. "Good," she said. "You don't have to do anything else. I'm right here." She straightened. She picked up the scalpel. Hargrove had read textbooks about emergency field surgery. He had, as a resident, watched one open abdominal procedure from the observation gallery above the OR. He understood the general architecture of what she was about to attempt. He did not understand how she was going to do it with what was on that tray. She opened the peritoneum in layers with a precision that had nothing to do with the instruments available and everything to do with the hands holding them. Each incision placed where it needed to be. No hesitation between decisions, no pause to recalculate. She worked the way someone works when the procedure has been in the body's memory long enough that thinking about it is no longer part of doing it. She was in the abdominal cavity within 90 seconds. Hargrove stood against the wall and did not speak. Speaking felt like the wrong thing to do. She found the source of the bleed, a mesenteric vessel, torn by the force of impact against the stair edge, not large enough to kill him in minutes, large enough to kill him in the ones she didn't have left. "The larger clamp," she said, without looking up, without raising her voice. Hargrove looked at the tray. His hand was unsteady when he picked it up. She took it from him without stopping what her other hand was doing. She applied the clamp. The bleeding slowed, then stopped. She packed the field. She held pressure and counted in her head. 58, 59, 60. She released and assessed. The bleed had stopped. She could not repair the vessel here. She did not have the right suture material, the retractors, the suction, the anesthesia, or a second pair of hands. What she had was a clamp holding and a man whose pressure had stopped dropping. 73/41, still low, not falling. She began to close. The suture was wrong for abdominal fascia, too fine, too light. Designed for skin lacerations, she knew exactly how to compensate. The course had not appeared on her official resume, taught by people whose names were classified, covering exactly this. Closing a wound with what was available in a way that would hold long enough, each suture tied with a specific knot. She closed each layer. The wound dressed and taped with the efficiency of someone who had done it in conditions where the tape had to hold through movement and pressure and time. Gloves stripped. She looked at the monitor. 71/43. Rising. She stood back. She breathed. The room was completely silent. Hargrove had not moved from the spot where he had handed her the clamp. He stood against the wall with the linen napkin still tucked into his collar, and an expression on his face she had not seen there before. Not the contempt, not the practiced authority, not the managed surface of a man running a room he didn't deserve to run. Something underneath all of that. Something that had not had a chance to be visible until now, because now was the first time, in all his years of practicing medicine the way he had practiced it, that he had stood in a room where medicine was actually being practiced. He was looking at Claire Weston the way a man looks at something he did not know existed until he saw it. She cleaned her gloved hands with gauze. The monitor readings got recorded next. She did not look at him. "EMS should be in the lobby," she said. His voice was different from any voice she had heard him use. "How did you know how to do that?" Not a question. Something between a question and a confession. She looked at Ashford. His color was still poor, but his lips were no longer that pale lavender. His breathing had slowed. The monitor showed his heart rate falling from 112 to 93. His pressure was climbing. "He needs a blanket," she said. "Hypothermia will compound the blood loss. There should be one in the left cabinet." "How did you know?" "The blanket, please." He found it. He brought it without speaking. She spread it over Ashford's legs and torso, careful not to disturb the dressing, tucking the edges the way you tuck when you need it to stay. The chair came close to the table. She sat. Not because her legs were tired. Because sitting next to a patient told them, without words, that the crisis was over. That someone was choosing to be beside them rather than moving away from them. Ashford's eyes opened slowly. "Did you—" he started. "Yes," she said. You're going to make it, she said. She said it with the certainty she had manufactured from nothing in other rooms, in other years. She said it because it was true. His eyes closed. The close of a man who believed the person beside him. Behind her, Hargrove had not moved. "What's your name?" he said. Such an ordinary question at such a strange time. She had worked in his clinic for 11 days. "Claire Weston," she said. "That's not what I mean," he said. She heard the outer clinic door open, the rolling of wheels. EMS. She stood. She walked to the door, one hand on it. She was going to open it and meet them in the hall and give the handoff and step back. She was going to become the temporary nurse again, the new girl, invisible. Which doctor performed this procedure? She heard one of the paramedics say it as they came through the outer door. A pause. Hargrove's voice behind her. Quiet. "The nurse," he said. Another pause. "The new nurse," he said. She pushed through the door. She gave the handoff in the rapid sequential format she had used in situations where the person receiving it was also under pressure. Mechanism, vitals, interventions, current hemodynamics, watch points. The lead paramedic was writing as she talked. He looked up when she stopped. "You opened his abdomen," he said. "I controlled the bleed." "With what?" "A suture kit and a 16 gauge. He stared at her. "The clamp needs to be visualized in OR before anyone touches anything," she said. "Treat him like the vessel is still open because functionally it is." He turned to his team. "Backboard. Minimal movement. Go." They moved. Ashford was on the stretcher and rolling in under 3 minutes. She stood in the doorway and watched them go down the corridor. A few people had gathered at the far end of the hall, the wide, uncertain eyes of people who had never been that close to something real. She turned back to the clinic. Examination room 1. She looked at the table, the blood, the instruments, the empty IV bags. She stood in the room and let herself be still for exactly 4 seconds. The careful 11 days of invisible had just come apart. She cleaned the room. She was halfway through when Hargrove came in. He stood in the doorway. "Where did you learn that?" he said. She set an instrument on the clean tray. "It doesn't matter," she said. "It matters enormously." A voice she had not heard him use before. That was not nursing. That was not general surgery. That was what needed to happen, she said. She set the last instrument down. She turned and looked at him directly. Without the careful downward cast she kept as a matter of practice. He took a small step back. The recognition of a person standing in front of you who is simply not what you believed them to be. "The board will need to know about this," he said. "Legal will have questions." "The man is alive," she said. He stopped. "The man is alive," she said again. "You can figure out the paperwork." She walked past him toward the supply closet. Her hands needed something ordinary, something to keep the rest of her from processing what had just come undone. She was reaching for the gauze on the second shelf when the building moved. Not from wind, not from the elevators. A deep structural tremor that started far below and traveled up through the floor and into her feet and her legs and her chest before her mind had fully processed it. She went still, turned toward the corridor. One breath, slow, through the nose. Her arms went cold. She knew that smell, 3 years ago. A place that no longer had a name in her official record. She walked to the clinic door, opened it. The hallway air was different, not the neutral recycled building smell of the past 11 days. Something carried in it now, faint and unmistakable, the way a single note changes the chord that holds it. The hairs on the back of her forearms rose. Frank Mercer's voice came over the intercom, distant, flattened by the speakers. "Attention, all staff on floors 11 through 15. The intercom cut out. She turned back to Hargrove. "Get everyone on this floor to the east stairwell," she said. "Not the elevators." "What? Why? What's happening?" She was already moving. The smell was the first thing that had told her, not the sharp bite of fresh ignition. This was older and heavier, the smell of something burning inside walls, inside the closed cavity of a structure where fire had been building patience for longer than anyone noticed. She had learned to identify it in places that no longer had names on any public map, in buildings that no longer stood, in situations that no longer appeared in any record she was permitted to discuss. And she knew what it meant. It meant you were already behind. The intercom had cut out in the middle of Frank's sentence, which was its own kind of message. Claire was through the supply closet in 4 seconds. The portable oxygen units came off the bottom shelf. Both trauma bags unhooked from the wall, and she started filling them without looking, the way she filled things when her eyes needed to be somewhere else. Gauze, rolled bandages, 3 saline bags, tape, trauma shears, every syringe on the second shelf, the last 2 pairs of nitrile gloves, the small betadine bottle she had requisitioned in her first week over Hargrove's objection that corporate clinics didn't need betadine. They always needed betadine. Hargrove appeared in the doorway. "What are you doing?" he said. "Preparing." "For what?" "Exactly? The building schedules quarterly drills. I should know. I sign off on the emergency klaxon activated. Not the soft 2-tone chime of a quarterly drill. The full alarm, the sound designed by engineers to remove ambiguity from any situation it entered. Hargrove went still. Claire shouldered both trauma bags, picked up the portable oxygen unit in her left hand, and walked past him into the corridor without another word. The hallway outside the clinic had already changed. The recycled building air was gone, replaced by something warmer and textured. A thin, visible haze collected near the ceiling tiles. Not smoke yet. The precursor of it. The way light changes before a storm arrives, and the sky turns a color that does not have a name. 2 people stood in the hall looking upward. A woman in a gray blazer with her phone pressed to her ear. A man from the operations floor with his laptop bag hanging open and his face pulled into the specific expression of someone who has not yet decided whether to be afraid. "East stairwell," Claire said without stopping. "Not the elevator. Go now." They looked at her. Blue scrubs, sneakers, a nurse. She was saying something with a certainty that belonged to a category of voice they had never heard before and could not immediately explain. They moved. Claire walked the full length of the 12th floor, knocking once on each office door. Hard. Not a question. Not running. Moving with the deliberate, controlled pace she had learned in a course with no name in any public record, in a facility with no windows, about how to move people out of a compromised structure before the structure fully understood what was happening. 41 people on the 12th floor counted on her second day without explaining why to anyone. She needed all 41 moving before the air became something you could no longer walk through upright. She reached the east stairwell door, pressed her palm flat against it. Not hot. She opened it 2 inches and listened. No smoke on this side. Clear air rising from below. She propped it open with a chair from the corridor and came back into the hall. People were emerging from offices now, some with bags, some with nothing, standing in the hallway, looking at each other, waiting for someone to give them permission to take the situation at face value. "This stairwell," Claire said, loud enough to carry the length of the corridor. 12 to ground. Stay right. Keep moving and don't stop. They went. She moved against the current of them, back along the corridor, checking each office. The woman in the corner office had not stood up. On the phone, hand pressed to her ear, the expression of someone who has decided that the voice on the line is more real than the alarm on the ceiling. Claire took the phone out of her hand without pausing, hung it up, set it on the desk. "East stairwell. Now." The woman stared. 9 years in this office. A plant on the windowsill she watered every Tuesday. Photos of her grandchildren lined up beside the monitor. She had not planned to leave any of this behind today, and her face said so. "Now," Claire said. The woman left. She kept moving down the corridor. Last office on the left. A man with headphones covering both ears, working. the full emergency klaxon apparently insufficient to reach whatever he was listening to. Claire pulled one headphone back from his ear. He turned. "Fire," she said. "Stairwell, let's go." He looked at her, then at his screen. Then he left the screen. She counted as they went. 37, 38, 2 more still. She found a woman near the West Corridor junction who had stopped walking. Not frozen, something worse. She had her back against the wall and both hands pressed flat to it, and she was breathing too fast in the shallow, rapid way that preceded a faint. Claire reached her in 4 steps. She took the woman's face in both hands. "Look at me," she said. The woman looked. "Your name," Claire said. "Patricia. Patricia, your legs work. Your lungs work. The stairwell is 40 feet from where you're standing. I need you to breathe through your nose and walk." "I can't." "Yes, you can. Not hard, just certain. Breathe through your nose. Walk with me." Patricia breathed through her nose. Patricia walked. 39. The last one was a man Claire found in the copy room with the door half closed, standing over a jammed printer with the expression of someone who had decided that fixing the printer was the appropriate response to the current situation. She put her hand on the door. He looked up. "That printer will still be jammed tomorrow," she said. "Stairwell, east side." He blinked. He went. 40. She went back to the clinic. Hargrove was standing in examination room 1, looking at the IV bags hanging from the pole, the instruments on the tray, the blood on the table that an hour ago had been proof of something impossible and was now just a thing that had happened in a room that was becoming a different kind of emergency. "The equipment," he said. "The patient files. There's sensitive. Not worth what you're thinking about trading for it." He looked at her for a long moment. A long, quiet, revising kind of look. "Stairwell," she said. "East side. I'll be directly behind you." He went. That was 41. She went through the stairwell door last. Through the small window she looked back at the 12th floor corridor. The thin haze from before had dropped to shoulder height. Rolling slowly along the ceiling toward the west end of the floor. The fire was in the walls on the west side. She could feel it through the door. Faint, but present. Not faint for long. She turned and went down with the current of people moving toward the ground. The stairwell was a river of bodies, pressing down, shoulder to shoulder. The sound of 300 people breathing and moving and holding it together in the compressed air of a concrete shaft. She stayed close to the wall. She watched faces. The faces of people in emergency stairwells have a specific quality. They are very present. All the things a person usually carries behind their expression, the planning, the worry, the distraction, it all falls away, and what is left is just the face and the moment. She had spent years reading faces in difficult conditions, and she could see these people were going to be all right. They were moving. They were together. They were going to make it out of the building and stand on the pavement and look up at the fire and be grateful for the rest of their lives for every ordinary Tuesday that had not been this Tuesday. At the 6th floor, she stopped at the wall phone in the alcove and called Frank's desk. 8 rings. She let it ring to 12. No answer. She set the phone down and stood for a moment with her hand flat on the wall and thought about Frank Mercer. His bad left knee. His Marine Corps thermos. His daughter starting college in September. His habit of talking to himself at the elevator bank when he thought no one was listening. His voice saying Weston in the morning, the same way every day, with the same particular nod that meant I see you, and you don't have to explain yourself to me. She thought about all of that. Then she kept moving. The plaza outside Meridian Tower had become, in the 20 minutes it took to evacuate 25 floors, the kind of controlled disorder that emergency response teams train for and are never fully prepared for. Fire department units had established a perimeter. Ambulances staged at angles to create a buffer zone. Paramedics moved between people with oxygen masks and the particular efficiency of people whose training had just become the entirety of their world. Above it all, the building burned. Visible in the 14th and 15th floor windows, the orange that glass had no business carrying. Claire handed the trauma bags to the paramedic nearest the entrance as she came out, without breaking stride. She moved through the plaza counting faces, along the edge of the triage area, along the back of the crowd behind the perimeter line. Frank's face was not in any of it. She went to the battalion chief at the command post. She gave him what he needed. 12th floor cleared. 41 personnel confirmed out before she sealed the stairwell door. Air quality on 12 dropping fast on her way out. The fire was in the west walls of 13 when she last checked the temperature of the stairwell doors. She gave it in order of operational importance. He listened while he worked his radio. When she stopped, he looked at her directly. "Which unit are you with?" he said. "Clinic nurse from 12, she said. 1 second of looking at her, then back to his radio. She turned and went back toward the building entrance. She went up, not toward the lobby, not toward the... into the stairwell from the secondary entrance on the south side, which the fire department had not yet locked, and up, 13th floor door. She pressed her palm flat against it, hot enough to feel from an inch away. She passed it. 14th floor door. She pressed her palm against it, warm. She opened it. The 14th floor corridor was thick with smoke, real smoke, not the thin haze from 12, but the body of it. Chest height and rising, the overhead fixtures turned grey and amber inside it. She pulled her scrub top up over her mouth and nose, low, moving. Her right hand trailed along the left wall, counting doors by touch. The overhead lights were grey and amber inside the smoke. The air had a particular texture at this level, not just heat, but particulate, the kind that settled into the lungs and started its work without announcing itself. She moved fast. Most offices empty. Most people already gone. Most, but not all. And the ones who weren't gone were the reason she was here. She found a man collapsed near the water fountain on the right side. 50s, heavyset. He had made it out of his office and lost consciousness in the hall. Smoke inhalation. His color was the wrong kind of pale. She checked his airway, clear but compromised. She tilted his head back and gave 2 rescue breaths. His chest rose. She felt his pulse at the carotid. Weak, but there. She got her arms under his shoulders. 230 pounds at least. She adjusted her grip the way she had learned to adjust her grip in conditions that made a smoke-filled corporate corridor look like a favorable situation. She dragged him toward the stairwell. Every muscle in her back and legs working in the controlled, systematic way of a body that knew what it was doing even when everything else had already cost it. She reached the stairwell door, got it open, got him through. His weight shifted onto the doorframe for a moment. His lungs were working, pulling in the cleaner air from the stairwell, the deep, involuntary breathing of someone whose body has been making do and is now allowed to catch up. He groaned. "Good. Stay with me," she said. 2 floors down, firefighters came up, full gear. They took the man from her without being asked. 14, northeast corridor, she said without stopping. 1 more possible victim at the far end. Smoke is chest height and rising. Keep your airway above it. She turned and went back up. The second victim was a young woman near the far end of the 14th floor corridor. Conscious but not oriented, she was asking about her laptop. "We're leaving the laptop," Claire said. She took the woman's arm over her shoulders and got them moving. The smoke was higher since the last pass. Time was shorter. The woman's weight was unevenly distributed, leaning hard, but her legs were working. That was enough. She got her to the stairwell and handed her off to a firefighter coming up. "Keo exposure, mild to moderate, confusion, no trauma," she said. "She needs oxygen on the ground." "Ma'am, you need to come down now," the firefighter said. "We've got teams on this." She was already on her way up to 15. The 15th floor door handle burned through her sleeve. She used the fabric to hold it. She opened it 3 inches, heat and light on the other side. Not smoke. Flames. She let it close. The boundary. Back down, floor by floor. checking each landing, moving fast now because the stairwell temperature was rising and the structural sounds from above had changed in the past 3 minutes from occasional to continuous. The building was in the later stages of what fire did to buildings when it was allowed to go long enough. Those stages were in manuals that most medical professionals never saw. She knew what came after. Claire came out of the stairwell into the lobby and moved through it toward the outside entrance, her pace unchanged, her face unchanged, all the cost of the past 40 minutes kept strictly internal. Her legs were heavier than they had been on the way up. Her lungs were doing more work than she was letting her face show. She had been up and down 14 floors twice in the past 40 minutes while breathing compromised air. She was aware of the cost of that without allowing the awareness to change what she was doing. The body kept a running account. She had learned to let it run without looking at the balance. The battalion chief was at the entrance when she came through. He looked at her. The smoke on her scrubs, the burn on her sleeve, the deliberate, unhurried walk of someone who had just come down from a floor that was on fire. "How many?" he said. "2 from 14, she said. "Hand it off to your teams. 15 is fully involved, I confirmed it. I told you not to go up there." "Yes," she said. He looked at her for a moment, not angry, something else. "Come to the triage station," he said. "You need oxygen and—" "In a minute," she said. She went to the perimeter line and walked its full length. Frank Mercer's face was not in it, not in the triage area, not in any of the ambulances visible from her position, not in any of the faces she could read through the glass of the paramedic van on the east side. She had watched Frank Mercer arrive at his desk every morning for 11 days. She knew exactly what his face looked like at distance. He was not here. She went back to the chief. "Lobby security," she said. "Frank Mercer, 61, bad left knee. He stayed at his post." The chief checked his radio. He came back to her. "Teams are working 13 and 14. Lobby was visually swept on initial entry. If he's not out here, his desk is 6 feet from the main entrance," she said. "I know where it is. Structural integrity of the lobby is—" "I know the building," she said, the same tone, the same specific weight of it that ended conversations without raising a voice. A firefighter stepped in front of the entrance. She looked at him. "His name is Frank Mercer," she said. "He has a daughter starting college in September. His desk is 32 feet straight back from this door." The firefighter looked at her. He looked at the battalion chief behind her. The chief said nothing. She went inside. The lobby air was wrong. Not on fire. Not yet. But saturated with the heat of everything burning above it, the way a room gets when fire is living in the ceiling and has not come down yet, when it is still gathering itself for what it's about to do. She called out, "Frank." Her voice went flat against the marble. "Frank Mercer." She moved through the lobby, past the reception desk, past the elevator bank, all doors sealed and locked down, around the security desk. He was there. Of course he was there. 61-year-old Marines with bad knees do not leave posts they believe are theirs. Not for alarms, not for smoke, not for the sound of things failing above them, because somewhere in them something cannot be untrained, and the thing says, "You stay." He was conscious, and he was pinned. A section of ceiling material had given way near the service corridor, and a beam, not large, had come across his left leg at the knee. The bad one. He looked at her when she came around the desk. "Weston," he said. His voice was even. Was the voice of a man who had made a certain kind of peace and was mildly surprised to see an interruption. "I figured you'd come back," he said. "I figured you'd stay," she said. "Habit," he said. "Same," she said. She crouched beside him and assessed the beam. 40 pounds, maybe 50. The angle was workable. She got her hands under it. She braced her feet against the floor, positioned her back under the load, and lifted. It came up. She held it. "Clear your leg," she said through her teeth. She heard him drag himself. 6 inches. 8. Enough. She set the beam down controlled. She got her arm under his and got them both upright. His left leg was not going to carry anything tonight. "Knee is done," he said. "It was done before tonight," she said. Something in his face that was almost a laugh. They started moving toward the entrance. 32 feet. She had measured it on her third day at Meridian Tower. Old habit. 25 feet. Above them, the building made a sound, deep and structural, starting somewhere on the upper floors, traveling down through the steel and concrete frame the way sound travels through bone. They kept moving. 20 feet. The sound came again. Longer. Closer. She had heard that sound before in a different building in a different country, and the physics were universal. Structural failure was patient. It was patient for a long time, and then it was not patient at all. 15 feet. 10. A firefighter appeared at the entrance, unable to come further because debris was beginning to cross the threshold between them. He was calling for the nurse from 12. She pushed Frank forward. "Go," she said. "Not without—" "Go," she said. The finality of it, the specific tone that ended things. He heard it. He went. The firefighter got through the gap and reached Frank and had him. They were out. The section of lobby ceiling between her and the entrance came down. Not all at once. The way a cliff face goes, the edge first, then the next piece, then the next, each one following the one before it, with the absolute patience of gravity doing what gravity does. She went back, not in panic. The instinct was not to run but to assess, because assessment was what you did before you did anything else. Because a decision made without it in a building that was actively failing was the last decision you made. There was a service corridor behind the security desk. She had noted it on her third day at Meridian Tower, east face of the building. Service exit at the far end. She had counted the distance from the security desk to that door. 92 feet. She went into the corridor. Dark. Not total dark. Emergency lighting had failed, but a faint orange bleed came through the right wall from the lobby where the fire was now descending from above. She ran her left hand along the opposite wall. Smooth drywall, cool, passable. She counted steps. The heat on her right side increased as she moved east. At step 40, she felt the wall temperature shift under her trailing hand. She moved to the center of the corridor and kept going. Step 60. Step 70. The door was there. She could see the shape of it in the dark, the outline of the frame, the cold light pressing around its edges from outside. Her hand found the door handle. It was cool, not hot. Cool, which meant the fire had not reached this side yet, which meant the door would open, which meant this was going to work. She was thinking about Gerald Ashford in surgery at the trauma center across the city, about Frank's daughter and September, about the 41 people from the 12th floor behind the perimeter line, about the woman from 14 who had been asking about her laptop and was safe somewhere beyond that line, about the fact that the door was in her hand and the outside was on the other side, and that was a finished thing, a complete thing, a thing that meant everything she had started today was done. Then the service corridor found something pressurized, a gas line, a duct, something the fire had been working toward for the past hour in the dark inside the walls. The concussion was instant and total. The floor came up. Her ears rang in the way ears ring when sound exceeds what they were designed for. Her vision tunneled, the edges going dark. She knew that tunnel, had been in it before, in worse places than this. She knew the distance from the floor to standing. 6 seconds. She got her hands under herself. Up. She walked to the door. It opened. The night air came in like something she had forgotten existed, cold and clean and full of the ordinary sounds of the world outside. She stepped through. The East Plaza was empty. No crowd. No lights. Just the open air and the sirens around the corner and the faint orange cast rising against the sky from the upper floors of the building at her back. She walked toward the corner. She made it 6 steps. Her legs stopped. Not all at once. The way things stop when everything has been spent and the account reaches 0, quietly and without drama. She sat down, her back against the east wall of Meridian Tower. The stone was warm behind her from the fire inside it. Voices around the corner. Radios. Someone counting names from a list. She looked at her hands. Both there. Both steady. She had been told once in a room with no windows by a man whose name was not his real name, that the hands were the last thing to go, that the hands remembered longer than the rest of the body did. She thought that was probably true. Her hands were still. Above the East Plaza, between the building and the dark, a narrow strip of sky. A few stars in it. She thought that was enough. She kept her eyes on it, still looking at it when the paramedics came around the corner and found her. The official report noted that Claire Weston, RN, was found on the East Plaza of Meridian Tower at 1947, 11 minutes after the structural event in the main lobby. Unresponsive on arrival. Cause of death. Blunt force trauma to the chest. Consistent with the pressure event in the East Service Corridor. Inside the building, voluntarily, after all other personnel were confirmed, evacuated. The report did not note what the battalion chief said to his incident commander the following morning when they reviewed the evacuation record. He said the nurse from 12 had reached 11 of the 14 confirmed victims on the upper floors before fire department personnel arrived at those levels. He said she had given him a structural assessment of the building floor by floor with a precision that did not come from a nursing degree. He said he had been in this work for 22 years, and he had never in those 22 years seen anyone move through a compromised structure the way she had moved, like she had been there before. Not this building, a building like it. Frank Mercer gave his statement from a hospital bed. His daughter sitting beside him with her hand on his arm, his leg in a cast that would need 4 months to come off. He said she had known the distance of the service corridor on the east side, that she had counted it weeks before, the way you count things you might need later. He said she had done that with every exit on the floor, every stairwell, every distance between things that might matter. He said he had known since her first week that she was not who she appeared to be. He said he hadn't asked because some things you don't ask. You just make sure you say good morning every single day. You just make sure that whoever they're pretending to be, they know somebody sees them. He was quiet for a moment. His daughter held his hand. He said he wished he had asked. He said he would have liked to know her actual name. Hargrove gave his statement outside the building with the linen napkin from the board lunch still, improbably tucked into his collar. He was asked to describe what had occurred in the clinic that afternoon. He described it. He was asked whether he could explain how a corporate clinic nurse had performed an emergency abdominal procedure with a basic suture kit and a 16-gauge needle in a room with no surgical equipment, no anesthesia, and no surgical team. He was quiet for a long moment. He said no. He said he had asked her the same question and she had told him it didn't matter. He paused. He said that was the most honest thing she had said to him in 11 days. He still had the linen napkin in his collar when he said it. He looked at it. He left it there. He left. He did not fully understand why he left it there, but he did. Gerald Ashford survived the surgery. He was told in the recovery room that the woman who had stabilized him in the clinic had not come out of the building. He asked for her name. They gave him the name from the employment file. He asked if that was everything. They said it was everything in the file. The medical examiner found the rest. Under the left sleeve of the blue scrubs, on the inside of the forearm where the skin is softer. A small tattoo, a unit designation, and a service number. The kind that combat medics sometimes put in places no one sees, in case of exactly this. In case the name in the file is not enough. In case someone needs to know. The Army confirmed her identity the following afternoon. Staff Sergeant Claire Marie Weston, 18th Special Forces Group, attached medical element, decorated twice. Service record classified. Separated from active duty 3 years prior, reason classified. On paper, she had come to Meridian Tower from a rural clinic in Montana. On paper, she had spent 6 years doing blood pressure checks and flu shots. On paper, she was a temporary replacement who had never planned to stay. A man came from the Army to handle the formal notification. He stood on the East Plaza at the place where the paramedics had found her. He stood there for a long time without speaking. Then he said she had always been like that. He said there had never been a way to train it out of her. Not the skills, not the calm, not the hands that didn't shake. What they had never been able to train out of her was the going back. Every deployment, every situation where the calculation said it was finished, and she had decided the calculation was wrong. He said it was not a death wish. He said it was the opposite of one. It was a belief, complete and unshakable, that as long as she was still there, still functional, still breathing, it was not over yet for whoever needed her. He said the only difference this time was that this time she had run out of exits. He said it the way a person says something they have been carrying the weight of for a very long time. Gerald Ashford funded the memorial. Frank Mercer spoke at it standing on a cane, his daughter beside him. He said she had told him once that this position had high turnover. He said she had said it the way people repeat something they were told and don't believe a word of. He said he had believed her at the time, when she said she might not stay long. He believed her less about that now. The east face of Meridian Tower, rebuilt in the years after the fire, carries a plaque at eye level beside the service exit door. Just her name. And below it, 2 words. She stayed. This story was inspired by the real events of February 1st, 1974, in São Paulo, Brazil, when fire consumed the upper floors of the Jolma building and claimed the lives of 179 people. They were office workers, secretaries, accountants, security